Hello everyone, I am Dr. Dilip Kumar. Greetings to all the viewers of Health Inside. So, what I am going to do today in a brief 5 minutes time, I am going to discuss about the very common problem but very fatal, that is heart attack. So first I want to clarify here what is a heart attack and what is heart block. So is there any difference between these two entities? So definitely these are two very different entities. In heart attack there is a blockage in coronary arteries, the blood vessels which supply the myocardium. And heart block, there is a problem in the conduction system of the heart. Like we have just like electricity, cables and wires are there, and finally we can see the bulb lit. Similarly in heart, from SA node to AV node there is a conduction system is there, and the electricity pulse is generated, and then finally heart gets contracted and it keeps on working. So there is a problem in conduction tissue, then we say it is heart block. But heart attack happens when there is a blockage in coronary arteries. So why we are talking more of heart attack? Because these are commonly missed. Patients say that they have got some discomfort in chest. We thought it is a gas disorder because of the gastritis, and they take pantoprazole or many other tablets for gas, and they basically miss their golden hour. So first I must tell you what is the difference between a heart attack, acute coronary syndrome and stable angina pectoris. So heart attack happens when there is a 100% occlusion of a coronary artery which is supplying the heart, and stable angina happens when there is a when we are 10-year-old, the atherosclerosis process starts in our body. Atherosclerosis means plaque deposition in the vessels, arteries. So in coronary arteries it also starts happening, and over a period of years and years it develops to 60%, then 70%, then 80%. So once the patient is having 75 to 80% disease in a coronary artery, then what will happen, when he walks around and even exerts, he will get chest discomfort, and when he sits and take rest and he relaxes, then the chest discomfort goes off. This is called stable angina. And once a patient has stable angina, he has coronary artery disease, he has ischemic heart disease, but he should not be panicky, because with medicines the patient do well many years and nothing to be worried about. But the second entity which I was referring, which is in layman term called heart attack, in medical term we call myocardial infarction. Here lies the problem, where we get we sometimes the patients lose their life. What happens is there is a blockage of 50%, 60% atherosclerotic plaque is there, suppose 80%, and all of a sudden on this blockage there is a plaque rupture happens there, and the artery gets 100% blocked. So once there is 100% block, there is a timer starts, and timer start means you have 12 hours time. If you open the artery within 12 hours, it means you are going to salvage the heart which is supplied by that coronary artery. Suppose you have failed in you have unable to do any angioplasty or a thrombolysis or proper treatment. So what is going to happen is that artery is occluded for 12 hours 100%, then that part of myocardium gets permanently damaged. So after 12 hours, 24 hours, if you open the vessel, then also the chances of recovery is less, because most of the myocardium in that area is damaged, and many times it leads to complications, mechanical complications sometimes, and if untreated or partially treated, then in future it can lead to arrhythmias, it can lead to heart failure, it can lead to recurrent hospitalizations because of all of this. So that was what I was wanting to discuss with you. A heart attack is acute blockage of coronary arteries, and it has to be treated as early as possible. And what are the symptoms? Symptoms is you are not exerting, you are sitting around and you start developing chest pain, central in nature, compressing. You will feel that 10-20 kg of body, some weight has been put over his chest. It can radiate to jaws, it can radiate to your left upper limb, and it can be associated with sweating. You start sweating at that time. So this is a typical symptom of heart attack. Pain in, right side of chest, left side of chest, cutting pain, these are not cardiac pain. These are but pain which I described earlier. If similar type of pain happens to you, I have already told there is a golden hour concept. Reach as early as possible. I will not say a time frame, 10 minutes, half an hour, 1 hour, as early as possible. Okay, that is the importance of our discussion today, what I am giving you the message. And second is how to prevent. Prevention is very important. So suppose it has been happened to you, you have gone to hospital, angioplasty is done, and then you are okay, no problem. But how to prevent it so that it shouldn't happen to you? It is also possible if you change your lifestyle. And these are, number one is smoking. And then if you treat your hypertension well, you keep your diabetes under control, keep your lifestyle healthy in terms of workouts, and check that your body mass, the obesity is not there, increasing. You have to shed your extra body weights. And dietary habit is equally important, and it has been told at every forum by nutritionists, cardiologists, physicians. Less of carbohydrate, more of fruits, vegetables. So these are important. And lastly, I must tell you, who are those people who have to be more and more conscious about their health. Everyone should be conscious, but there are some population which are particularly at higher risk. And who are these patients? Number one, those patients who have family history, whose father has died of heart disease, whose brother has bypass surgery or heart disease, mother had some problem with heart. These patients will be having heart problem in majority of the times. Number two, if someone has diabetes, someone has hypertension, someone is obese, body weight is high, and sedentary lifestyle. He doesn't do work, physical work. He is working on laptop, computers, day in, day out. So physical activity, if someone not doing sedentary lifestyle, so these are the patients who are very, very vulnerable for heart attacks and also stable angina patients. So change your lifestyle, be aware, and act promptly when you feel you have symptoms which I just described. It will make you much safer. Thank you so much.